My name is Richard Hurder. I'm a retired naval officer and a retired hospital administrator. Worked at Rowan Regional Medical Center for 22 and a half years. Worked in the medical field in the Navy for 22 years. I started out as a medical corpsman and worked my way up to medical administrative officer in the Navy. Retired from the Navy, came to Salisbury as the assistant director at Rowan Regional, and retired from Rowan Regional in 22 years as the chief operating officer. I directed the clinical affairs of the hospital, and all the clinical services reported to me. So I spent a lot of time with physicians and nurses and technicians, and have a pretty good understanding of what good medical care is, and a pretty good understanding of what it takes to provide good medical care in this day and age. And I've been more than pleased with my experiences here at Piedmont Interventional. This is, in my opinion, the most well-run, well-managed office I've been in a long time. Dr. Wilson provides leadership that makes me as a patient feel comfortable. I feel that the people here know what they're doing. I know that he knows what he's doing, and it makes me comfortable, and it makes it easier to submit to the care that they're providing when you know that they know what they're doing, and they have had success with a lot of patients. If you really look into it, you're going to be amazed at how many patients in this town come here to get relief of their pain, and get it because of the way things are done here. By specializing, as Dr. Wilson does, in the treatment of pain, he's able to accumulate a lot of experience, a lot of knowledge in what works and what doesn't work. And I think that's how he came to the mile procedures. He found that it gave him an opportunity to treat a problem, lumbar stenosis. Had some back pain that kept getting worse and worse and worse. I had my knee replaced a year ago. That helped for a while, but then it got bad again. Now this other knee isn't working so good. And I had read that there are physicians now called pain care specialists, like Dr. Wilson, that can help in that kind of problem. And so I came over here, and I knew Chris from when he was in the orthopedic business here in town. And so I came over and saw Chris. He got me an appointment with Dr. Wilson. And Dr. Wilson started working with me, and at first just tried medicine, and that helped for a while, but then it got worse again. So then he did epidural injections, and they worked for a good while. They worked for a few months. But they were beginning to not work anymore. And then I read about this mile procedure and asked Dr. Wilson to talk to me about it a little bit, and he said, well, you know, it works for some people and not for others. What we need to do is get an MRI. And it turned out that the MRI indicated that I have the condition and the symptoms that the mile procedure is intended for. I have very thickened ligaments in my back, and the mile procedure is intended to reduce the thickening, and that's what he did. So we went ahead and tried the mile procedure, and for me, so far, it's worked very well. Not a cure. I've still got a little bit of pain, but not much, and I'm in terrible shape. I haven't really done much walking or anything like that for over a year since I had this knee replaced. And I've got to learn to walk differently because of my knees, but I haven't been able to do that because the pain in my back was such that it limited my ability to work and to walk. Well, now that the mile procedure's been done, at least the pain is gone, so now I can start to work out and walk a little bit, and it's going to take a while, but If I hadn't gotten rid of the pain, I wouldn't even try. I mean, if I still had the pain, I'd be so preoccupied with that I wouldn't even bother worrying about anything else. Now that the pain is so dramatically reduced, I'm ready to start working out, and that, for me, that's going to be a benefit. I feel better. So that's what Dr. Wilson and this procedure have done for me. This has worked very well. It worked as good as the epidurals injections, but it's worked longer. It's been 3 weeks today, and I've probably gotten rid of, I don't know, 70, 80, maybe 90% of my pain. And that's worth the price of admission. I could not walk from one side of the Food Lion store to the other. I go in the Food Lion, I have to go for bananas and oranges over here, and I have to go all the way across the store to get milk and orange juice. I couldn't walk all the way across Food Lion unless I had a cart to lean on. And now I'm just over there this morning picking up milk, and I walked over there just fine. So that, you know, that's, I mean, because I haven't been doing any exercise or anything, that's the only test of no mobility that I can think of. And the other thing is, I couldn't stand up, like when I wanted to shave and stood in front of the mirror, I couldn't stand up straight and shave. I had to like lean on the sink and shave, because one of the characteristics of this problem is that as you bend forward, that space opens up, and as you straighten up, it closes. So what I had to do is I had to walk in and lean on the sink and bend forward, shave, because it hurt to stand up straight. Well, it doesn't now. I couldn't make my bed because I couldn't bend over and pull the sheets up and pull the blankets up, everything, because I couldn't stand up straight. Now I can. One of the reasons I wanted to try these mild procedures because it's not big surgery. I don't want to take a chance with any big surgery if I don't have to. The beauty of what has happened so far is that now I don't have the pain to worry about, so I can try to work on my walking, and I couldn't do that 3 or 4 weeks ago. The thing that attracted me the most was it's done under local anesthesia. It's not, you don't have to be put to sleep. It's as minimally invasive as it can be, and you know, there's always danger in a surgical procedure, but there's very little with this. The mild procedure means it's not, you know, I didn't think of it as risky. It was done as an outpatient, and went in there about 1 o'clock, 1:30, something like that. I was out of there at 2:30, so maybe 3, and I was up walking around that evening. So I enjoy Dr. Wilson, and I respect him tremendously, and Chris, because they clearly understand what I need and how to help me get it. I certainly don't have any qualms about recommending Dr. Wilson and his team as people that will give you the best chance of getting relief. I wouldn't want anybody to think I'm saying, I promise you you'll be better. I'm just promising you you get good care. And that's really all anybody can promise. You know, best surgeon in the world can't promise he'll cure you. He can just tell you, I'll do the best I can. And that's what Dr. Wilson and his people do. They do the best they can.